Hi, so let's talk about arthritis in the foot and ankle and what we can do about it. This is a really common thing to have, and essentially osteoarthritis is just wear and tear of the joints. Arthritis technically means inflammation of the joints, but when we're talking about osteoarthritis, it really means that the cartilage has been worn away, sometimes after a trauma, but often just through the course of your life, using those joints time and time again. The cartilage wears away, inflammation occurs, and it becomes quite painful. All of the joints in the foot and ankle can become arthritic, but the most common ones are probably the big toe joint and the ankle joint because they do the most moving. I'm going to cover those separately in another video, but when we're talking about osteoarthritis in general, there are a lot of things that you can do to help yourself. So the first thing would be to try to decide what it is that causes most of the pain and then avoid that. Most people have already done that, but it might be something you consider yourself. Good shoe wear is really important for arthritis. The cartilage that helps protect the joint has worn away, so we need to put something in its place, and if you can wear good, thick, padded shoes and not walk barefoot, that often is enough to take away the pain and save you needing any intervention from someone like myself. When we're talking about arthritis in the big toe or ankle, a rocker bottom shoe can be really helpful. Now there's lots of companies that make rocker bottom shoes, to name a few: Hoka, MBT, Skechers, Asics. They're very mainstream and they are designed, I think, to help people who run, but they're very helpful for people who have arthritis in those joints. Hot and cold can be helpful, often cold if it's inflamed or hot if it's just giving general discomfort. And what I'm talking about there is essentially heat packs and ice packs. When it comes down to medication, there isn't anything that takes away the pain particularly well, and certainly evidence shows that taking pain relief for this sort of thing isn't a very good idea if you can help it. It's better to treat it more mechanically or come to someone like myself if you can't manage that. When it comes to what I can do for you, the first thing, as with everything in medicine, is diagnosis. It would almost 100% be the case that I would want to get a weight-bearing x-ray of your foot or ankle, depending on where the pain seems to be, after I've thoroughly examined it. Once we've made a diagnosis, I'll give you the information about what can be done, what you can do to help yourself, and what I can do. The first thing I would often start with is an injection. That would be a steroid, which is essentially an anti-inflammatory, and a local anaesthetic. It's a single needle into the joint. I use x-ray to make sure I'm in the right joint, and it's a very quick procedure, usually done in clinic in the x-ray room. There's no downtime from this. You come in, have the injection, go home, and we will see what happens. When it comes to the outcome of injections, everyone's very different. Some people have an injection and go away with excellent pain relief for many months or even years. Some people have an injection and the pain comes back in a few days. It's really difficult to say, but what we can certainly say is if you do have an injection, it's a good diagnostic tool. Because the local anaesthetic takes all the pain away from the joint that's being injected, if the pain goes while the local anaesthetic is working, which would be for a few hours, we can be sure that it's all coming from that joint. If it doesn't go, then we have to think about pain that may be coming from somewhere else. If the injection doesn't work, we can give more than one, but the risks of the injection start to go up when we're giving multiple injections over the period of months or years. So we try to avoid that if we can. After injections, if they're not working, comes surgery. And surgery is very specific to each joint, but essentially we're looking at clearing away extra bone or loose cartilage if the arthritis is not too progressed, through to fusing the joint if the arthritis is very progressed. Now, a joint fusion is essentially where we remove all the joint, pull it together and put a plate or screws over the top. The reason for this is to fool the body into thinking that it has a fracture, and it heals the joint, so we end up with no joint at all, and that tends to take away all the pain because the pain is coming from the joint. No joint, no pain. A very good operation, but always the last resort in these cases. please book in to see me and we can talk it through and work out exactly what you need.